please.
Assalamu alaikum.
Start your
Bismillahirrahmanirrahim.
presentation, Dr. Naila Bajwa.
Quote of the day: the best investment you have ever made is your own health. Today, the topic of my presentation is health service utilization.
Please check your sound system.
Learning outline of my presentation is a definition of different terminologies, evaluation of health service utilization, utilization rate, and the model, Edison and Newman model of health services utilization, barriers in health service utilization, improvement in how we improve the health service utilization, and recent updates. In the end of this presentation, participants will be able to describe different terminologies related to health, model of health service utilization, utilization rates, and how we improve health services. Healthcare is a general term comprising services provided to improve health in the general population as well as to cure disease and relieve symptoms in a diseased patient. Healthcare may be provided with different organization of like private or public hospitals and the facilities which are provided in that hospitals. Healthcare assess. Healthcare assess
Dr.
is the
Naila, we
extent
can't hear you.
to which the patient and groups
Please
have
check your
access.
mic and be loud, please.
Healthcare assess is the extent to which patient and group have assessed the healthcare, and it depends upon the two conditions: the general living condition of the society, like economic resources, manpower for healthcare, and availability of healthcare facilities and transport system to reach them, and organization of health services, like the services which are provided in primary and secondary care, adequate staff at various levels, geographical distribution, and insurance system to cover the cost. Now we define health system. The WHO defined health system as all organization, people, and action whose primary intent is to promote, restore, or maintain health. The concept thus include not only public and private healthcare facilities and staff, but also health insurance organization, water control, occupational health and safety legislation. The WHO has described a health system framework consisting of 6 building blocks: service delivery,
Dr. Naila, please, you have to stop here. Please
WHO has
stop
described
the
a health
recording,
system
stop here,
framework
and
consisting of
start
6
your
building
presentation
blocks like
again.
service
You should
delivery,
let in
health
other students and
workforces, medical
also,
workforce,
please,
health
we can't
information,
hear
vaccine
you.
and technologies, financing, leadership and governance. Health service utilization. People use health services for many reasons, including preventing and curing health problems, promoting maintenance of health and well-being, obtaining information about their health status and prognosis, What is utilization rate? Utilization rate or actual rate is expressed as the proportion of people in need of services who receive it in a given period, usually in a year. It depends upon availability, accessibility of health services, and the attitude of an individual towards healthcare system. How we describe these utilization rates, like proportion of infants who are fully immunization against 10 EPI diseases, and the trends in the vaccination coverage is remarkably increased. According to the Pakistan Demographic Health Services survey, like in 1991, the vaccination coverages is only 35%, and now according to 2017 and 18 PDHS survey, it is remarkably increased, almost 66%. Proportion of pregnant women who receive antenatal care or have institutional deliveries. There is trend in the changing in the place of delivery. In 1991, only 13% deliveries. मैम मैं बहुत कोशिश कर रही हूँ, वो नहीं टेंशन नहीं हो रहा मुझसे, मतलब कोई लिस्ट में नहीं आ रही है पार्टिसिपेंट्स वाली। मैं एडमिट फिर करूँगी ना, वो मुझे उसमें शो नहीं हो रही सारी लिस्ट में। जी मैंने किया है। मैम ये कंप्यूटर के माइक में कोई इशू है, मैं कोशिश तो कर रही हूँ। जी मैम वो proportion of pregnant women who receive antenatal care or have institutional deliveries. The trends in the recent 20 years is remarkably change in the utilization rate. Like in 1991, only 13% deliveries are conducted in home, but now this trend is changed up to 66% deliveries conducted in the primary healthcare facility center or institutional deliveries, and antenatal coverage is also increased from 26% to 80%. Percentage of population who adopt family planning. There is also increase in the trends of use of family planning in 2017 and 18 survey. यार एक मिनट, मैंने सब कुछ किया, अब क्या करूँ, दोबारा शुरू करूँ सारा कुछ? अच्छा
पहला प्लीज स्टार्ट करें।
बिस्मिल्लाहिर्रहमानिर्रहीम। Quote of the day: the best investment you have ever made is your own health. The topic of my presentation is health service utilization under kind supervision of Dr. Saira Afzal. The learning outline of my presentation is the definition of different terminologies, evaluation of health service utilization, utilization rates, Anderson and Newman model of health services, barriers in health services utilization, how we can improve health service utilization, and recent updates. In the end of this presentation, participants will be able to describe different terminologies, model of health service utilization, utilization rate, and how we improve health services. First, we define healthcare. Healthcare is a general term comprising services provided to improve health in the general population as well as to cure disease and disease and relieve symptoms in diseased patient. Healthcare may be provided by different organizations like private and public facilities, and the healthcare is provided in these centers. Healthcare assess. Healthcare assess is the extent to which patients and group have access to healthcare, like general living condition of a society in which economic resources, manpower for healthcare, availability of healthcare facilities and transport system, and the organization which are formed for provide the health services like primary and secondary care, adequate staff at various level, and insurance system to cover the cost of healthcare facilities. The WHO defined health system as all organization, people, and action whose primary intent is to promote, restore, or maintain health. The concept thus include not only public and private healthcare facilities, but also health insurance organization, water control, occupational health, and safety legislation. Basically, the WHO has described that health system framework consisting of 6 building blocks: service delivery, health workforce and medical workforce, health information, vaccine and technologies, financing, leadership, and governance. What is health service utilization? Actually, the health service utilization is the services which is used by the people for many reasons, like preventing and curing health problem, promoting maintenance of health and well-being, obtaining information about their health status and prognosis. What is utilization rate? Utilization rates or actual rate is expressed as the proportion of people in need of a services who received it in a given period, usually in a year. It depends upon availability, accessibility of health services, and the attitude of an individual towards healthcare system. Like proportion of infants who are fully immunized against 10 EPI diseases. Trends in vaccination coverage. Percentage of children, like according to Pakistan Demographic Health Service survey, in 1991, only 35% of people getting vaccination, but now this trend is remarkably increased and it is 66% coverage of vaccination according to 2017 and 18 PDHS survey. Proportion of pregnant women who receive antenatal care or having institutional deliveries. These trends are also changed. In 1991, only 13% deliveries are conducted in the healthcare facilities center, but now this trend is changed and 66% deliveries are conducted in proper places. And the antenatal coverage is also increased. In 1991, only 26% of pregnant females receive antenatal coverage, but now this trend is changed and 86% of pregnant females receive antenatal coverage from different health centers. Percentage of population who adopt family planning. The trends are also changed in regarding family planning. In 1991, 12% females adopt family planning, but now 35% have couples get for a family planning. Utilization rate also um, this also count by bed occupancy rate, a bed turnover rate, and average length of stay of the patient. Like bed occupancy rate is calculated by average daily inpatient number divided by average number of beds in that hospital multiplied by 100. The international standard for bed occupancy rate is between 80% to 85%. And if the bed occupancy rate of any hospital above the 85%, then there is a greater chance of communicable diseases or overcrowding of that hospital. In Pakistan, average ratio of population to bed in hospital is 1:1450. Bed turnover rate. Bed turnover rate is calculated with the help of formula discharges along with deaths divided by average number of beds multiplied by 100. And average length of stay of the patient in the hospital is calculated in the days with the help of this formula. Day of care rendered in the hospital after admit and the day of discharges. Dimensions for evaluation of health services. We can evaluate our health service utilization by different factors like our health services are comprehensive. A comprehensive range of health services is appropriate, preventive, curative, palliative, and rehabilitative services and health promotion. Accessibility services are directly and permanently accessible with no undue barrier of cost, language, culture, or geography. Health services are close to the people with a routine point. How the health service delivery is how the health service is coverage. Health service delivery is designed so that all people in defined target population are covered. Continuity. Service delivery are continued. Continuity of care across the network of services, health condition, level of care, and over the life cycle. Quality. What type of qualities are provided by health services? It is a high quality, effective, safe, centered on the patient needs, person centeredness. The services which are provided are organized around the person, not the disease. Coordination. Local areas, health services networks are actively coordinated across types of provider, types of care, level of service delivery, and for both routine and emergency preparedness. And the last point is accountability and efficiency. Health services are well managed so as to achieve the core elements described above with a minimum wastage of resources. Managers are allocated the necessary authority to achieve plan objective and held accountable for overall performance and results. Now comes the model of health services utilization, which is known as Anderson and Newman model of health services utilization. The purpose of this framework is to discover conditions that either facilitate or impede utilization. Basically, it is a behavior model that provides measures of access to medical care. This framework was first developed in the 1960 by the Anderson and Newman. There are three factors which are involved in this model: predisposing factors, enabling factors, and the need for care. In the predisposing factor, the socio-cultural characteristic of individual that exist prior to their illness, like social cultures, education, occupation, ethnicity, social network, social interaction, and the culture. Health beliefs, attitudes, values, and knowledge towards the healthcare system, and in the demographic factors, age and genders are included. These are the predisposing factors of this model. Enabling factor, the logistic aspects of obtaining care. How to assess health services, income, health insurance, travel extent, and quality of social relationship, like and community available health personnel and facilities and waiting time and possible addition genetic factors and psychological characters. In the need factors, functional and health problems that generate the need for healthcare service. There are two types of need: perceived need and evaluated need. How people view their own general health and functional state, as well as how they experience symptom of illness, pain, and worries about their health and problems. And in evaluated need, it represents the professional judgment about people's health status and their need for medical care. These are the diagrammatic representation of this model, Anderson and Newman. These are the predisposing factors in which demographic, social culture, and attitude beliefs are included in enabling factors. Family resources and communities are involved, and need for care and illness. It is perceived and evaluated. For example, if we use antenatal care services utilization, then the predisposing factors of a female are their age, education level, marital status, employment status, and health services. And in enabling factors, insurance status, distance to health facilities, getting money to go, and companionship to health facilities. And in need factors, desire for pregnancy, desire for a healthy baby, having chronic disease, then these all are the factors, and a female receive antenatal care services. There are major systematic challenges which are faced in the health services utilization, like fragmentation in our system and the fragmentation. Health services relate to the coexistence of several units or facilities that are not integrated into a single network and provide services at different levels of cares that are not coordinated, and healthcare deliveries that does not cover the entire range of promotion, prevention, care, rehabilitation, and palliative care services, and services that do not continue over time. And over next systematic challenge is segmentation. The coexistence of subsystems with different modalities of financing, affiliation, and healthcare delivery, each of them specializing in different strata of the population according to their type of employment, income level, ability to pay, and social status. Barriers reported by patient. There are different barriers which are reported by a patient or a healthcare providers, like socioeconomic status, health insurance status, transportation problems, language barriers, and immigrant status. These are the barriers which are reported by the patient. And some barriers are reported by a healthcare provider, like resource limitation, confidentiality limitation, transport facility, availability of all drugs, and training constraints. How we improve health service utilization. We improve health service utilization by comprehensive and progressively expanded health services, increase investment in the first level of care, improve and increase the response capacity of the first level of care, improve human resources capacity in the first level of care, employment, multidisciplinary new profiles, essential medicine and technologies, empowerment of community participation, identify the unmet and differentiated health needs of the population, intersectoral collaboration. We improve our health services with the help of universal access rather than universal coverage. What's the difference between universal access and universal coverage? In universal access, there is absence of geographical, economic, socio-cultural, organization, or gender barriers that prevent all people from making equitable use of comprehensive health service. And in universal coverage, there is sufficient organizational mechanism and financing to cover the entire population. Universal coverage in itself is not sufficient to ensure health and well-being and equity in health. What are the needs that pushes and we change over health service utilization, like change in demand, demographics, epidemiology, people's expectation, change in the offer, knowledge and technologies are changed, workforce issues, financial pressure, and social change, globalization, reforms of the state and sectoral reforms. These all changes leads toward the better health service and health service utilization. Now it's coming the recent updates. This is one of the article, health service utilization and out of pocket expenditure in public and private facilities in Pakistan. A breakdown of total out pocket expenditure shows that 81% was spent in the private sector and 10% was earmarked by public health facilities. Basically, this article is related that in the Pakistan, there is a better services is provided in the in the private sector, and the mostly people avail their health services in the private sector rather than the public health facilities. The National Health Accounts reports in 2015-17 shows that Pakistan is heavily reliant on the private sector for healthcare services, with approximately 85% of total health expenditure being at private facilities. 58% were in the form of out-of-pocket expenditure, and 1% was private voluntary health insurance contribution, and 35% was government, which is spending on health. These are the graphs which show that in the according to the according to the provinces in Punjab, there is outpatient public facilities is shown by a uh, blue color, which is this, and outpatient private facilities which are up by the people are almost increased, and these all are shown by this graph. Now it's time for the MCQs. A tertiary care level hospital is provided with 1,500 beds on average. 1,400 beds remain occupied round the year. Calculate bed occupied rate of this hospital. It is a little bit calculation. Any guess?
B.
C is the correct answer, 93%. Large number of Pakistani population is living in rural areas. However, health services are mostly centered in urban localities. This kind of healthcare provision highlight the principle of equity, equality, comprehensive approach, community participation.
Equality.
A.
A is the right answer, equity. In peri-urban area, a local resident donated room for the working of immunization team. This is an example of comprehensive approach, community participation, intersectoral collaboration, or appropriate technology.
B.
Yes, B, the community participation. A married female, 30 years of age, belong to low socioeconomic status, presented in OPD for antenatal care. According to Anderson and Newman model, this factor described in this scenario come under the heading of predisposing factor, enabling factor, perceived need, and evaluated need.
A. Predisposing factor.
Right answer A, predisposing factor. Healthcare professionals make a policy that for healthy babies and mother, the minimum number of antenatal visits should be 3 or more. This is perceived need, evaluated need, need for illness, or enabling factor.
Evaluated need.
Evaluated need. B.
B is the right answer, evaluated need, because healthcare professional make a policy that there should be 3 or more antenatal visits for a pregnant female. In a tertiary care hospital of Lahore shows that bed occupancy rate is 93%. In Pakistan, average ratio of population to bed in hospital is
C.
C is the right answer, 1:1450. Government has set up committees at Union Council level. The member of these committees include representatives of the Department of Agriculture, Education, Environment, and Social Sciences. This committee shows intersectoral collaboration, community participation, health system, or a community approach.
A. Intersectoral collaboration.
A is the right answer, intersectoral collaboration. In tertiary care hospital settings, many patients admitted or discharged on daily basis. The average bed turnover ratio shown by discharge divided by average bed multiplied by D is the
Beta.
right answer, discharge including deaths, average number of bed in that hospital multiplied by 100. In a particular hospital, there were 2,000 discharged in the year of 2020. Number of bed in that hospital was 400. So the bed turnover rate of this hospital is 400, 450, 500, 550.
500. C.
See, 500 is the right answer. 2000 divided by 400, which is equal to 5, and then multiply by 100. So the answer is 500. Absence of geographical, economic, socio-cultural organization or gender barriers that prevent all people from making equitable use of comprehensive health service. This approach of health services show universal access, universal coverage, health for all, primary health
A.
care. A is the right answer.
Universal access.
Universal access. This is the key of MCQs, references of my presentation, and thank you.
Thank you very much, Dr. Naila. I first applaud your effort. You have done a lot of good work, and the most of the topics that you have covered in your presentation are very clear. They were concise, and you have done a lot of good presentation skills. Now you are delivering with quite confidence, and that is one of the good things. Your MCQs again something that should again be applauded, because you have made correct MCQs according to the scenarios, according to the concept that has been delivered in your presentation. You started with checking those concepts. If you please stop the recording here, I want to say something, because we know there are always strengths as well as weaknesses. So let me